Next, Dr. Cassidy with the Medical College of Wisconsin will dive deeper into health and science behind the toolkit.
Hello, thank you. It's a privilege to be here today talking with all of you, and I've learned so much from the business community. It's been a great partnership. Next slide, please. We created this toolkit because there's so much information out there that it's overwhelming. Every day there's new information, there's new guidance, and it can be overwhelming. So we started looking at the information that was out there and what we felt was important and we felt was accurate. And then, you know, when I first looked at guidances from major corporations, it could be overwhelming as well. So we wanted to conceptualize a framework and how you think about this for your particular business. And we know that the virus spreads from person to person, and it can be spread through things we touch. So we came up with the concept and the framework of protect the workforce, protect the customers, and protect the facility. And when we have these guidelines for you, there's some general topics that apply to everybody. But when you're thinking about your own business and your own interactions, there's ways you're going to have to tailor it to meet your specific needs. So the things you need to think about are the number of people in any given space, how they interact, how the employees interact with each other, how they interact with their customers, and how they interact with the facility. We do know that the more people in one space for a longer duration increases the risk of spread. So, for example, if you have a hair salon, you have one employee and one customer, and they are interacting closely. They have to touch each other, but the other customers do not need to touch each other, and the other employees do not. But they're also using the facility, so you have to think about how do you protect that individual customer, that individual employee, and the things they touch, and that can be through face masks, through sanitizing the environment in between customers, and thinking about that approach. Also, increasing ventilation, opening doors and windows is good. But then if you have another situation like a fitness center where you have a few employees and many customers, and they're moving from equipment to equipment to equipment, if somebody has the virus, they can pass it from equipment to equipment, and you can see how it could spread throughout the facility. So there you need to be extra especially cautious about your equipment and how you sanitize it. You might want to do things like schedule appointments for working out so you don't get too many people in there. So these are, you know, you have to be creative in how you think about this. Next slide, please. And so the things we know is that the virus is spread from person to person and things we touch. And so it goes in through your mouth, and that's how you get it, your nose, mouth, and eyes, your respiratory system, and that's how it comes out. So since it's spread from person to person, social distancing remains incredibly important. If we stay away from each other, the virus has nowhere to go. And since it goes in through your respiratory system and out through your respiratory system, it's very important to use face coverings as much as possible when you're around other people. Close that door. Don't let it in, don't let it out. And then again, it's so hard not to touch our face with our hands. So that's why it is so important to continue diligent hand washing. Keep doing it. I don't even think we realize how much we touch our hands and touch other things and touch our faces. So that's really important. And also the disinfecting. You can clean, but cleaning does not necessarily kill the virus. It can remove some of the surfaces and grit where it might live and thrive, but you need to disinfect it to kill it. So we have the tools. We have tools at our disposal to prevent the spread. And we need to close the door, not let it in. We need to practice social distancing and wash our hands. And finally, if somebody's not feeling well, we need to enable them to stay home and to get testing in order to stop the spread. Thank you very much.